everyone. I hope you can all hear me. And I think people are joining the group. I think we're going to get started. And so let me first introduce myself. My name is Jenny Kwan. I'm the Member of Parliament for Vancouver East, and welcome to a National Pharmacare e-rally. I am so excited to see all of you joining, and then literally hundreds of people joining this e-rally across the country. Let me first acknowledge the First Peoples. I'm zooming in from the Musqueam, the Squamish, and the Tsleil-Waututh First Nations in their unceded Coast Salish territories. I have a number of special guests that will be speaking momentarily, but let me just go through, first of all, some housekeeping items with all of you. And seeing as that this is our first e-rally, it's very exciting to see how this is going to work. And I'm just so thrilled that so many of you have been able to take time to join with us today. So now please note that we are streaming live this event tonight. There are people who are on this Zoom. And there are also people who are live streaming this through Facebook as well. It literally is just like as if we are gathered together on the streets and just waving our signs, chanting with each other, joining with each other with one heart and one mind. Now, feel free to please turn off your camera during this event if you don't feel comfortable at any point in time about having your camera on. And please note also that this event will be conducted in English. We will be hosting a similar rally in French in a few weeks as well. So please do stay tuned and keep in touch with us on social media, on the various different platforms with information about that French rally later on. Now, please also put the setting as speaker view on your device if you can. You can choose that setting on the top right hand if you click view, and you can choose the speaker view on your device. Now, due to limited capacity, we're not able to have sign language interpretation. So I do apologize for that. However, this event will be posted on Peter Julian's YouTube channel along with caption, so that please visit his YouTube channel next week so that you can see the proceedings of today in the e-rally, and of course with the caption for those where we're not able to provide sign language interpretation at this point. If you have any questions or technical difficulties, please during this event, email us, and you will see on the screen the email address, which is emailing at info@pharmacarec213.ca. So that is info@pharmacarec213.ca. So please email us, and we will have somebody hopefully help you through the technical difficulties. Now, the plan for the rally is really quite simple. This is the first time ever that we have done this online as an e-rally. And so we are connecting with each other. We are reaching out to everyone to join hands to push for this very important measure for all Canadians. Now, in the next hour or so, we're going to hear from our leader. We'll hear from other dynamic leaders from our community, from health professionals about why we need pharmacare. When I was thinking about this issue, and for so long now, you will all identify this with me as well. The father of Medicare, Tommy Douglas, comes to mind. The icon, the best Canadian in our history, who brought this forward for us so many years ago so that we can all have universal health care. But it was always Tommy Douglas's dream that we would have pharmacare to go along with it. Because truth be told, what good is healthcare provision if we cannot get the medication to go along with our diagnosis, with the illness that we're faced with? So it was always Tommy Douglas's dream for us to have universal pharmacare. Now we know that the Liberals have promised universal pharmacare for decades now. Literally, this has gone on with their promise red book after red book, and still we do not have universal pharmacare. Canada is the only country with universal health care that does not have universal coverage for prescription drugs. And one of the barriers that we know for people in staying healthy is access for medication. Now, the Pharmacare Act, the Universal Pharmacare Act, the Canada Pharmacare Act, to which we're joined today with our e-rally, is based on the recommendation of the Hoskins Advisory Council on the implementation of national pharmacare, and that includes universal public drug coverage. The speakers coming on will tell you all the reasons why we need to have this. And we want to really launch this because we're going to be voting on a private member's bill that Peter Julian has tabled on behalf of the NDP in the House of Commons. This bill has been introduced. We've already begun debate on it, and we will be picking up debate on this in February. A vote will come, and it will put on the record every single member of parliament in the House of Commons where they stand. Lip service will no longer be good enough to say that they support universal pharmacare and then not support this very important bill, Bill C-213. Earlier on, we had launched a campaign and invited Canadians from coast to coast to coast to send their member of parliament a clear message. A message to demand that they vote in support of universal pharmacare, in support of Bill C-213. So we will see what happens when we get to that vote in the House of Commons in the coming days. Now, this e-rally is meant to bring all of us together to share some knowledge, to share our support in this regard, and to continue on the momentum to bring about this healthcare measure for all Canadians. So without further ado, I am going to introduce some of our very special guests. And just so that people know what the lineup is, we will have, of course, our leader, Jagmeet Singh, who will speak. And then after that, we'll have union leaders, healthcare professionals, and of course, our MPs, Peter Julian and Don Davies. So first, let me introduce to all of you somebody who really needs no introduction. Someone whom I have the pleasure of working alongside for a few years now. And in his capacity as a leader of the NDP, I have to tell you, there is no one who is stronger in his voice as the champion for the people. Always, especially in the face of the pandemic, he has put the needs of the people first and foremost at the forefront at every single turn, whether it be in the House of Commons, in private conversations, in meetings with the Prime Minister, with opposition members, in terms of the Conservatives, in terms of the Bloc or the Greens or anyone else. Top of the mind for Jagmeet is the people and their needs. And at every single turn, New Democrats is pulling the weight in the House of Commons and driving the issue forward so that we can get through the pandemic, so that we can come out stronger through the pandemic. And that is so why that universal pharmacare is so, so very important. And so with that, to all of you, please, I ask you to welcome Jagmeet Singh, the leader of the NDP, as our next speaker. Thank you so much, Jagmeet.
Thank you, Jenny Kwan, everybody. Can round of applause for our amazing MP, Jenny Kwan. She is so awesome. I learned this from Peter, that I do this all the time now. Amazing advocate. And we have, just so folks know, we have over 300 people. We have over 300 people in the Zoom call already. This is unreal. My internet is lagging now because it's so many people. It is unreal. This is awesome. This is an amazing number, and more people keep on joining. I see them jumping on. So this is incredible. And as Jenny was saying, this is the first time we've done something like this. To see so many people participate, it's amazing. We're now at actually 338 people already. I think we're going to hit 350 by the time this is over. This is amazing. This is so exciting. So thank you to everybody. Un grand merci à tout le monde pour être partie de ce mouvement. Thank you for being a part of this movement. Really appreciate all of you. A big shout out to Peter Julian, who is my House leader, but also who is presenting this bill as a private member bill on behalf of our party. So big thank you to my friend, Peter Julian. We've got lots of MPs on the line as well. We got, I see on this screen alone, I see Don Davies. I already mentioned Jenny Kwan. We've got lots of folks. So those are the folks that are on my screen right now. It's kind of one of those random things. That's the folks I can see. But thank you for joining. We are fighting for universal pharmacare. And when we think about this pandemic and what it has meant, people have hurt. People have lost their jobs. People who had benefits lost those benefits, and that meant they lost their job and they lost their benefit. They're even in a worse position than ever to afford medication. And in a pandemic, when people need to stay healthy, the thought that people cannot afford their medication, to me, is just so wrong. It should not be this way. And as Jenny mentioned, every other country in this world that has universal health care included medication. Because if you go into a doctor and they prescribe to you a way to get healthy, you need insulin or you need some medication, and you can't afford it, well, what was the point of allowing you to go in and get diagnosed if you can't actually afford the treatment? It makes no sense. And that's why this bill is so important. This bill is laying the foundation for the framework for how we can actually achieve universal pharmacare. And don't listen to any of the trolls that tell you that this bill doesn't matter. Of course it matters. The commission that the Liberal government actually put in place recommended this bill as one of the steps. And the Liberals, as we know, as Jenny mentioned, will say a lot of nice words, will make promises, but they don't actually commit to action. So we're going to say, you know what, you're not going to do it. We'll do it for you. We'll lay out the framework that your own commission recommended. We'll lay out the framework for universal pharmacare. If you need medication in this country, you should not be using your credit card. Instead, you should use your health card. That's our vision, and we believe it's achievable. So this bill, we need you all to put out the word. We want to see which way people vote. We want to put pressure on people because this is a clear sign. Do you believe in universal pharmacare or not? Are you willing to stand up to big pharma or not? Do you believe that everyone in our country should get access to medication when they need it? That's what's at stake right now. That's the big question. So again, thank you to everybody for joining. I'm really excited. We can make a big difference. As Jenny was saying, we started this journey. New Democrats believe that it should not matter how much money you have in your bank account. It should not matter how wealthy you are. If you need healthcare, we believe every single person should be able to access it. On top of that, we believe if you need medication to stay healthy, every single person should be able to access that medication. That's what this is about, continuing that dream and that vision of a truly universal healthcare that's there for everybody. Every single person should be able to get healthy. Being healthy should be a human right. And this is a big part of that, being able to stay healthy by accessing medication. So are you ready? I know folks have signs. So I'm going to ask you all to get your signs ready. We're going to take a big picture. So this is a big part of our movement today. We're going to share this on social media. This is going to be an awesome picture. So if you got a sign, I want you to hold it up, have your face in it as well. Hold up your sign. I'm going to read you mine. It says, "Nous avons besoin d'un régime pan-canadien d'assurance médicaments qui est universel, accessible, abordable." We need a universal healthcare system or universal pharmacare system, which is universal, accessible, affordable for all. So get your signs up. Oh my goodness, this looks amazing. I'm going to have a special friend join me here. She's more than my friend. She's actually my wife. She's going to join. And if we can have our team, hold it up. Yeah, it's good. And if we could get our teams to take a picture of this looks so good. Everybody have your signs. And then maybe we'll do a video if you can wave your signs around like if we're in a rally. Yes, that looks so cool. Let's get a video. People do thumbs up. Nima Mashiv is doing a thumbs up. Do a thumbs up if you don't have a sign and you agree with this. This is going to be a great picture, everybody. Take a video of this as well. If anyone who's doing this, I hope it's being recorded anyways. That's great. Yes. Thank you, everybody. Love you all. Back to you, Jenny. Thank you.
Well, I think it's my turn to talk. Welcome, everybody. I'm Don Davies. I'm the Member of Parliament for Vancouver Kingsway, and I'm privileged to be the federal NDP health critic. And I'm also calling in from the unceded traditional territory of the Coast Salish people, the Musqueam, Tsleil-Waututh, and Squamish, upon whose grace we gather. So, thank you all for joining us tonight. And it's first of all my privilege to thank Jagmeet for his outstanding leadership, not only on pharmacare, but on progressive policies that will benefit all Canadians across the board. You know, I think it speaks to Jagmeet's commitment and compassion and caring for all that he decided that the very first bill that we would introduce in Parliament on behalf of the NDP through Peter Julian, our House Leader, is the Canada Pharmacare Act. So thank you, Jagmeet, for your leadership. Like Tommy Douglas drove healthcare and the New Democrats drove healthcare into the Canadian fabric, you are leading the way on pharmacare. It's now my privilege, though, to introduce our next speaker, Linda Silas. Ms. Silas has been the president of the 200,000 strong Canadian Federation of Nurses Unions since 2003. As the dynamic and charismatic leader of Canada's largest nurses organization, Linda is recognized as the foremost advocate on behalf of nurses in Canada. And I can tell you personally, she is the clearest, most forceful, fiercest, and most eloquent witness I have ever heard at Health Committee for standing up for the health of Canadians and her members. So, Linda, it's a pleasure to welcome you here. The floor is now yours.
Thank you very much, Don. I come from Ottawa, the unceded territory of the Algonquin-Nawabish people. And I see Jenny was asking, I saw people registering, Jenny, from New Brunswick, Montreal, Saskatchewan, Alberta, Manitoba. So it is quite exciting. Peter, Don, Jagmeet, so nice to see you again. Jagmeet, last time I saw you, I was doing pad thai with you and I had pad thai for a week, but my partner learned how to love tofu, so it's all good. Jenny, it's great to meet you virtually and to be able to work with you. And thanks for giving me this opportunity to speak about an issue I'm passionate. I'm passionate about it as a social activist, but passionate about it as a nurse also, and a nurse for a few moons. We know as nurses, and we have a clear understanding on why there's a direct relation to have a national pharmacare program similar to our national Medicare program. And I would add, similar to what we need, our next fight is a national long-term care program. So we need to be looking at that. The issue for healthcare, it's the patient, because when you have a diagnostic and you have a prescription for medication, you need them. If not, you stay sick, you re-enter the hospital. But it's en français, on dit un couteau à deux tranchants, because it's also, as healthcare workers, the front line of healthcare workers, we see the cutbacks in healthcare. And then you see the wasted money that goes to big pharma, and you know we could do better. When you know that there's over 100,000 healthcare plans in this country, those are over 1,000 public plans. Imagine all the waste and the repetition that could just be fixed if we could do it together and do it better. As Jenny mentioned, it's our shame that in this beautiful country, in this rich country, we're one of the only country with a public healthcare system that doesn't have a pharmacare program. Over 3 million Canadians do not fill their prescription because of the cost. That we have to change. We, for the
Linda, I think you may have muted yourself.
Oh, sorry. You see, maybe that was a sign, Don. Thank you, Don. For the last 8 months, we haven't talked about nothing else than COVID. And as healthcare unions, we had to do it. We had to protect this healthcare workforce that have become warriors of health. and it really consumes us. So I do thank the NDP for not dropping the ball. You know, there's a great sayings. We have all kinds of balls up in the air, and some of them are crystal balls. We have to be very fragile about it. And the health of Canadian is one of those crystal balls. We have to be careful. And I do thank you for taking this. There's one thing about the pandemic, we realize that we have to make sure, just like Jagmeet said, that we do everything in our power to keep people healthy and out of hospital with any preventable measures we can do. And it's a no-brainer that prescription drug is part of that. And we fail. We fail so royally. Studies are coming out and saying that twice as many Canadians have lost their drug coverage than those who have gained it in the last year. So we need to do something about it, and this bill will change. We have to ask ourselves, do we accept the reality that 1 million Canadians cut their spending on food, on lodging, on recreation, just to pay for their prescription drugs? That's a crystal ball, as I mentioned, that we have to look closely. The first time I saw the Pharmacare bill, when the NDP staffers explained it to me, I thought, really, and then it clicked. It's a foundation. We're building a foundation to a humongous, strong house in Canada, and we needed this bill to have pillar similar to the Canada Health Act. And again, Peter, thank you for taking the lead and taking this as the first bill you're going to be pushing. So all of us, we need to talk to all our MPs to make sure they vote for this bill. And let's put everyone living in Canada on the same playing field. Merci beaucoup.
Well, thank you so much, Linda. You know, I think I speak for all of us when we point out that your leadership and the contributions of your members, this is nurses across Canada, have been and are so critical to getting us to this exciting point in history, because we know that it's nurses who are delivering frontline care to patients who see firsthand the problems that we have when Canadians can't get the medication that they need so badly. I'm just going to pause for a moment and mention to anybody who's watching that we have a link that is posted or will be posted to submit questions. We are going to have 15 minutes or so, hopefully at the end of this, in order to hear from you. So I hope the link is being posted now to those that are controlling that, and I encourage everybody to use that link, and we want to really hear from you. Now, I just want to say just a few words before I introduce our next guest. In the 2015 election, the New Democrats were the only party that actually put universal pharmacare on the national stage and talked about it during that election. And upon being appointed health critic in 2015, I had the privilege of moving the motion at the Standing Committee on Health to study universal pharmacare. Now that led to a 2-year study where we heard from over 100 witnesses from all stakeholders and across all disciplines. And I can tell you, I have never seen a more widespread support, a greater consensus for a public policy than I saw appear before that committee on pharmacare. And it ranged across all stakeholders, from medical professionals and allied workers to trade unions to the business community to academics. There is an absolute consensus for this policy. We also took the step of sending it to the Parliamentary Budget Officer to cost this out. And the conclusion was this: after these 2 years of studying on a Liberal-dominated majority committee, we issued a majority report recommending universal, comprehensive, and public pharmacare. And I want to pause and emphasize public and what that means, because right now, the Prime Minister of this country and his 3 health ministers he's appointed since 2015 have failed to this day to utter the word public. And I think it's very critical that we understand that we want pharmaceutical services added to the basket of publicly covered medical services in Canada. We do not want a public-private patchwork like they have in the United States. And there are solid reasons for that. It's because we only achieve the efficiencies that come from public delivery of medical services by having that go through our public system. And that was the overwhelming advice of every witness that appeared before our committee, other than the insurance industry and big pharma. And the interesting thing was the PBO came back to us, and the PBO is not a left-wing or left-leaning person. He's an objective office that used very conservative accounting principles and told us we can cover every single Canadian in this country's pharmaceutical needs and save over $4 billion every single year. And I'm not going to go through all the details of that, but the reasons of this are obvious. If we have bulk buying by the federal government for 37 million Canadians, if we have streamlined administration by processing medical claims through single medical services plans in the province instead of the 100,000 independent plans there are, if we have the savings that come from getting people their medication before they get sicker, that's called cost-related non-adherence. That saves over $1 billion a year. You put all these factors together with a disciplined formulary and better prescribing practices, and we can actually take those 7 million Canadians that don't have any coverage today, make sure they get the medication they need, and we can save billions every year doing so. So this is a social justice, health, and economic imperative. And of course, the Liberals, well, they decided after receiving that majority report to do what Liberals do. They stalled. But they stalled by appointing another advisory committee, and this would be the Hoskins Advisory Committee on Pharmacare, which is by my count the 9th committee, task force, commission that has studied pharmacare over the last 4 decades. But there was a surprise. I think if Mr. Trudeau thought that this would stall the implementation of pharmacare, he was completely taken aback when Dr. Eric Hoskins' committee, who was a Liberal health minister in Ontario, came up and recommended public, universal, comprehensive pharmacare. So here we are today with a Liberal government that says they're committed to pharmacare but won't move. Once again, the New Democrats led by Jagmeet Singh and Peter Julian have done the work for Canadians and for the Liberal government, and we've drafted the bill that would make pharmacare a reality. And it basically mirrors the same way we deliver healthcare services in all other ways, by establishing the principles behind pharmacare, having a federal transfer payment, and encouraging provinces to receive that money in exchange for covering these services, just like we do for broken arms, hip replacements, and every other kind of medical service that Canadians need. So where I'll conclude is the reason this is unstoppable is because of people like you. Millions of Canadians, over 90%, according to recent polls, support universal public pharmacare. And this will become a reality because of the Canadian public and the work of all of you who are working with us together to make this a reality. So it's my pleasure now to introduce our next speaker, Dr. Nima Machouf. Dr. Machouf is a lecturer at l'École de Santé Publique de l'Université de Montréal. She is an epidemiologist and has worked on AIDS and HIV issues for over 20 years. She is a strong defender of the public healthcare system and services, and she believes that health is a right, not a privilege. Dr. Machouf, thank you for joining us.
Thank you very much, Don. And thank you for being here, all of you. In fact, the idea of universal public drug insurance is not a new idea. It's not a new concept. The Hall Commissions, Royal Commission on Health Services, recommended even before I was born. And as Jagmeet said, almost all political parties have talked about it. Almost all have promised it. But will and courage to make it a reality is ours alone. New Democrats are the one who will make it happen. For us, health is a human right, not a privilege, meaning that universal access to physical and mental health care must be guaranteed for everyone. Much of this right has already been acquired, thanks to NDP, by the way. But we must supplement this right to healthcare with universal pharmacare. The Canada Health Act already guarantees us access to medical care, guarantees us access to hospital services, and to prescription drugs in hospital. At the time these laws were enacted, expensive cares and serious illnesses were treated in hospital. But nowadays, more and more health problems are managed at home because of our aging population. We have more and more chronic diseases. The ambulatory shift means that patients stay for shorter period at the hospital. Many diseases are treated on an outpatient basis, and thanks to technological progress, several surgical interventions are done without hospitalization even. But all of this means that if patients need drugs to fix their problems, now they have to buy them. So drug expenses are constantly increasing for individuals. As it has been said, an international survey of drug spending showed that 10 years ago, 6% of Canadians' families spends more than $1,000 on non-reimbursed prescription drug expenses. And if we look only at people with chronic health problems, such as diabetes or arthritis, this rate rises to 17%. And this is despite the fact that part of the population for which the health responsibility lies to the federal government is already have full drug coverage. I mean, for First Nations or members of the armed forces or prisoners, asylum seekers or people on social welfare, and all federal public employees, drugs are all fully covered. But for the others, 17% expenses more than $1,000 per year. We know that there is a direct link between precarity and health. The segment of the population with a lower income are also those who more often have bad habits, those who have worse living conditions, those who do not have the same life expectancy as the wealthy, and therefore more often have poorer health. In fact, the poorest fifth of the population live 11 years less than the richest fifth. Moreover, lower paid jobs are less often accompanied with these so-called social benefits, which include private insurance. Constant cuts and austerity policy means that several healthcare sectors have also been withdrawn from the public health systems that we have. Health insurance coverage keeps melting away, and no more coverage for eye care. We have no more coverage for mental health. We have no more coverage for rehabilitation, and we have no more coverage for dental care. Add to that the cost of pharmaceuticals. Regarding the cost of drugs and access to medication, compared to the other countries of the OECD, Canada is very inefficient. We spend more money per capita, drug prices increase faster in Canada, and we have no control over the price we pay. As it has been said, we have over 1,000 different private insurance companies that provide drug coverage in Canada. If we had one single public pharmacare, our negotiating power would increase considerably with Big Pharma. Our insurance plans are also unfair because they do not provide adequate coverage to many Canadians. On top of that, the pharmaceutical industry receives many tax advantages and government subsidies, but the industrial benefits are meager for the population. We need to fix all this. Sorry. Our opponents say that we cannot afford universal and public drug insurance because it's too costly. It's wrong. It's absolutely wrong. On the contrary, we cannot afford not to do it. As Don Davis said, a universal public pharmacare will cost us 10 to 42% less. We will economize money. We will be more equitable for the population, and we will be able to control the price because we will negotiate the price. Establishing such a system, well, it will not be easy. I know. We all know. We have 13 provinces and territories, and we must respect federal and provincial jurisdiction on the health matter as well. But the problem are not insurmountable. You know, the obstacle is not even economic, but political. The only thing standing in our way is having the will to get it done. So let's do it together and stop leaving anyone behind. Thank you.
Thank you so much, Dr. Machu, for sharing your expertise, your passion, and for your leadership. It's so important to have stakeholders from across the medical community speaking up for this very essential medical service. I'm going to pause here to ask the organizers, to put up a poll. We want to ask our viewers a couple of questions. I think there it is. And we encourage everybody to please get your views in on this. The first question is, have you or someone you know had difficulty accessing necessary prescription medication due to cost? And the second question we'd like to hear from you on is, have you contacted your Member of Parliament to support Bill C-213, the Canada Pharmacare Act, which will be coming up for debate and a vote sometime, I think, in February? So those two questions again, do you know anybody who's had difficulty getting access to prescription medication? And number two, have you contacted your MP to let them know how you feel about this important bill? It's now my privilege and my pleasure to introduce a very special colleague of all of ours, and that is Peter Julian. Peter is the Member of Parliament for New Westminster Burnaby, and he was first elected in 2004. By my count, he's been elected 6 times. I think you'll correct me if I'm wrong, which tells you everything you need to know about how popular he is in his riding and how hard he works for his constituents. But besides being an excellent representative at the community level, Peter is also one of the most stellar performers in the House. He is the NDP House Leader. He is our finance critic, and he is the sponsor of Bill C-213, which is the Canada Pharmacare Act. And if I may just say so, I believe he's one of the finest public servants in the country from any party. So Peter, thank you so much for your initiative on this, and I'm proud to turn over the floor to you for your comments.
Thank you so much, Don. And thank you for being so numerous tonight. We've got 350 here in the Zoom room, almost 200 out in the Facebook room, 550 voices right across the country raised to say it is time for pharmacare now. I'm speaking to you from the traditional territories of the Kite First Nation and the Coast Salish peoples. And I wanted to mention, thank you for the introduction, Dawn, that there are a number of other members of the NDP caucus that are present at this rally tonight. We have from Vancouver Island, Gord Johns, Rachel Blaney, Laurel Collins, and Randall Garrison, our terrific Vancouver Island team. From BC Interior, Richard Cannings. From Alberta, the hardest working MP in Alberta, Heather McPherson. Manitoba, Leah Gazan. From Ontario, Carol Hughes, who's the Deputy Speaker, and Brian Massey, who is our National Caucus Chair. Welcome to our caucus as well across the country, and welcome to you from across the country. The reasons for this bill passing on February 24th, that's when the vote comes, are very compelling. And we've heard from extremely compelling speakers to talk about the importance of pharmacare. With the COVID-19 pandemic, nearly 10 million Canadians don't have access to the medication and they need. We know that 1 million Canadians have to choose between heating their home or putting food on the table or paying for their medication. And many of them I know are in my riding of New Westminster Burnaby. Everyone knows somebody who is hurt by the absence of universal pharmacare in this country. And so it's an important date with destiny on February 24th, when members of parliament for the first time will be called upon to vote to take that first step and implement the structure around pharmacare. And that's why it's so important and so vital that folks showed up in so great numbers tonight for this e-rally. Now, our next speaker is equally compelling. Her name is Marie Clark Walker. Many of you already know of her. She's always fought for equality and social justice. She's a published author. She is both the first racialized woman to be elected executive vice president and the youngest officer in CLC history. That's the Canadian Labour Congress, representing millions of unionized workers in Canada. Marie has served as executive vice president for 5 terms before being elected secretary treasurer in 2017, making her the first racialized woman to hold that position. And she is also the vice chair of the Canadian Health Coalition. Thanks for your support of pharmacare. Marie, over to you.
Thank you so much, Peter. And it's great to see so many of you out there pushing for pharmacare. So I'm not going to go over what you've already heard. You know that this is not something new. We have been crossing the country for years talking about the importance of universal, single payer, public pharmacare. And we know that we've got to get it done. We've got to complete Tommy Douglas's vision. So you've already heard that Canada is lagging behind. We already know that just like hospitals and physician services, prescription drugs are an essential part of any healthcare system. But you only get it when you're in the hospital, and that is not fair. We know that. We also know that there are huge gaps in who gets prescription drugs and how affordable the medication is depending on where you live, how much you make, the status of your employment, your gender, and whether or not you're racialized or Indigenous. We all know that that has had significant impacts on ability to afford and ability to access pharmacare. So we also know that we're in the midst of a pandemic, and that pandemic has shone a bright spotlight, a very bright spotlight on all the inequities that we currently see. And so we know exactly what it means. Who would have thought, a year ago that by December of 2020, over 1 million people would be out of work and looking, not even being able to find a job, but out of work and not being able to afford their medications because they had no benefit plans. And while all of this is going on, Big Pharma and the insurance companies are continuing to block us. They're continuing to block every single person in Canada from having a universal single payer public pharmacare system. In fact, they're fighting really hard to deny access to drug treatments by holding up amendments to the regulations. They're pushing to tell governments that profits are more important than people, and we've got to stop that, and we have to stop that now. It's important that we put things in place so that no one is left behind. You heard Dr. Maroof, no one is left behind. It's so important. We know what it was like before the pandemic. We knew that 1 in 5 people did not have access to prescription drugs. Since the pandemic, we know that that's now 1 in 4. Nearly 3 million Canadians say that they were not able to afford at least one of their medications in the past year. And people also know that they're struggling. Those who are unionized and those who have plans are still struggling because they have co-payments, they have deductibles, and people cannot afford. And of the 3 million people, and I heard Linda say it and Dr. Maroof say it as well, of the 3 million people who could not afford their medications, 38% had private insurance coverage. So it's not like people don't have the coverage. 21% had public insurance coverage, but it didn't cover the costs of the medication. So we know where we are now. We know that it's 1 in 4 people that are not able to pay for their medication due to the cost of the medication. So they don't fill it, or they don't renew it, or they try and cut pills in half to make their prescriptions last longer. And that is definitely not the way to do it. We also see the inequities in terms of gender. More women than men paid more than half out of their pockets for their prescriptions. More racialized than non-racialized Canadian households lost their prescription drug coverage, 18% as opposed to 13%. More racialized than non-racialized could not afford their prescription drugs. 36% of racialized people could not afford their prescription drugs versus 21%. So there is a difference. So we are not a country where this should be happening. There is no way. What we want is simple: universal, single payer, public pharmacare. It is good health policy, it is good economic policy, and we need to accelerate it now. We need to accelerate the implementation, particularly because of the pandemic. It's not rocket science, it is in Hoskins' report. We need to start immediately with the implementation of universal single payer public pharmacare by providing an initial list of prescription drugs that will cover roughly half of all prescriptions in Canada. Don't you think we've waited long enough? I certainly do. This past year has proven that disaster can strike at any moment, and we have to be prepared. We have to disaster-proof our country so that when the next crisis hits, we can weather the storm. And this means implementing universal, single-payer, public pharmacare so that no one in this country has to decide between paying rent, buying food, or paying for their prescription medications, which are life-saving. We need this bill now. Thank you all very much.
Thank you so much, Marie. Thank you for your eloquence, and thank you for your passion on this issue. And all of our speakers have been fantastic this evening. We've been flooded with questions, and so if you haven't been able to access the Google link, you can email your questions to info@pharmacarec213.ca. That's info@pharmacarec213.ca. We've got tons of questions. We won't be able to answer them all, but I'm going to try to combine a whole bunch of them. And I'm going to come back to that poll question that Don Davies put out a few minutes ago. Elodie, if you want to put up the results. Have you or someone you know had difficulty accessing necessary prescription medication due to cost? 83% of folks who replied said that they know somebody or they personally been through that. And that is indicative of the kind of results we see right across the country. The other question, have you contacted your MP to support pharmacare? 2/3, 66% have, 34% have not. That still means hundreds of people that on this call tonight can follow up on the rally, and we'll come back to that in just a moment. Thank you very much, Elodie, for the poll. I'm now going to take a few questions that we've gotten from the audience tonight, and thank you so much for the terrific response that we've been getting from people. First, my question to Linda, and this is summarizing a number of questioners I'll put together. For your members, what type of situations do they see on a daily basis due to the lack of universal pharmacare in this country? And what kind of a difference would it make to reducing the impact on our hospitals and hospital visits with universal pharmacare?
Thank you, Peter, for the question. I think it's simple. It's the readmission and the readmission of people that could be home, families that could be united, people that could get healthy. And that's what really bothers us, especially when we're talking about children. We brought nurses to Parliament Hill to talk to MPs that were working with children with asthma. And the cost of keeping children in hospital when what they simply need are puffers and they could be taking it at home. So it's all that readmission and the stress on the families of staying in the hospital simply because you cannot afford your prescription drugs. And physicians don't have a choice. They have to keep them there. So that's the key example I'd want to give.
Thank you very much for that, Linda. And now, again, a combination of questions coming in around the labor movement to Marie Clark Walker. What is the labor movement doing to push this bill over the finish line? What are the affiliates doing? What's the labor movement strategy around making sure that we actually get pharmacare in Canada?
Thanks for the question. For years now, the labor movement has been pushing the issue of pharmacare. We do lobbies every year. We've been lobbying all of our MPs, not just at the federal level, because we've told people it's important to lobby at every single level of government. So provincial lobbying, as well as your municipal councillors, trustees, the whole bit. It's important that every single politician understands the importance and what it means to an everyday Canadian who does not have access to prescription drugs. So we are pushing that. We've pushed letter writing. We are in partnerships again with our friends at the NDP, with our friends at CFNU, the Canadian Health Coalition, and their provincial and territorial partners have constantly, they've had conferences, continue their letter writing campaign, and they have been doing lobbying, visiting their politicians' offices and homes. And we will continue to push for this because all of our members understand what this means for them, because they've all experienced situations where they can't afford their prescriptions.
Thank you very much for that, Marie. And now a number of questions have come on around something that's on everybody's mind right now, epidemiology. To Dr. Nima Mashouf, what role could universal pharmacare play in preventing and dealing with future outbreaks of disease? The pandemic, of course, is on everybody's mind.
Well, we will have more and more problem with public health problem with the way that we live, and this pandemic, it will not be the last one, unfortunately. So access to healthcare and access to drugs are one of the very important matter in health, in the health of the population. Regarding COVID, precisely regarding COVID, because it's a major health problem, all the cares were free of charge. Testing was free of charge for COVID. Testing was free of charge. Seeking help was free of charge. COVID drugs to alleviate pain or to alleviate the problem of inflammation in the population, in the patient, was free of charge. Vaccines will be free of charge, but it's not always like this. And if we regard not only the COVID problem, but all the other problems that the people have, even during this COVID pandemic, it's we have seen that they have problem getting their drugs because many people lost their job, many people lost their insurances, and those problems is worse in the time of a pandemic, and it will continue to be that. So a guarantee of having access to Medicare, to drugs freely, it will be a very important part of our healthcare system.
Thank
so
you.
We have to get it.
Thank you. Thank you. I certainly agree with you. Thank you very much. The next question, and they're coming in, a ton of questions coming in. So I'm gonna throw this one to Don Davies, and this is from Alex. How comprehensive would the drug formulary be, and how long do you estimate it would take to get newly approved and released drugs to be listed on the Pharmacare formulary?
Well, thank you for the question, and it's an excellent one. I mean, the bottom line is that we can construct as extensive a formulary as we want to. It's always been the NDP's vision that it be a very broad formulary, essentially so that Canadians can get the medication that their doctors prescribe for them. When the PBO did the costing for our pharmacare bill, they used the Quebec formulary as a model because the Quebec formulary is the broadest formulary in the country. But we also believe it's very important to construct a formulary that is evidence-based and is independent. It needs to be monitored by based on the principles of evidence and value for money, and it should be kept away from industry influence and from political influence. And BC has this excellent therapeutics initiative where they do some great work on evaluating the efficacy of pharmaceuticals. And so we think that it's possible, and in fact, it's actually being done all the time around the world, to construct a formulary that is disciplined, it is broad, it is flexible, and it allows patients to get the medication that they want. I might point out as well that we do believe as well in generic substitution wherever possible, but in cases where people need to get the brand name medication, then that should be an option as well for people. So we think that we can have the best, broadest formulary in the world.
Thank you, Don. The next question I'm going to toss to Jenny. It's from Tui in Vancouver. Why would any member of Parliament vote against this bill? What are the criticisms against Pharmacare and Bill C-213?
Well, thank you very much, Tui, for that question. I know that some will suggest that we can't afford it. We've heard this argument over and over and over and over again. And clearly, as has been indicated from the Parliamentary Budget Officer's report, from the Hoskins report, that we can afford it. In fact, it's quite the opposite. In going with a universal comprehensive pharmacare program, it would actually save Canadians money, both employers as well as employees. The research from the University of British Columbia and the University of Toronto and the final report from the Hoskins Advisory Council show that universal public pharmacare will instead reduce annual system-wide spending on prescription drugs by $5 billion each year, with businesses and employees seeing prescription drug costs reducing to the tune of $16.6 billion annually, and families seeing their out-of-pocket drug costs reduced by $6.4 billion. So that is the most common argument to say why we can't do it, because we can't afford to do it. So it's a false argument. The other one that people will say is, well, because, pharmacare is really up to the provinces. Well, we need a national plan. That's why this is the national call for action, to work with the provinces, to work with the territories, so every single Canadian can get the medication that they need.
Thank you very much, Jenny. And I'm going to take two quick questions from my constituents. From Catherine of New Westminster, she asks, how many people have signed the Pharmacare petition to date? Well over 50,000, the most recent iteration of the supports on the NDP national website, but we've had hundreds of thousands of Canadians who have indicated support for Pharmacare. Of course, as Don Davies mentioned, it's really through the roof in terms of popular support for Pharmacare. Organizations representing millions of Canadians have signed on. In terms of cities, towns, and villages, we've had dozens and dozens of cities and towns and villages across this country, all asking members of Parliament to vote yes. So we're getting groundswell of support across the country. And the final question, again, from one of my constituents, I will take advantage of that. Diane from Burnaby, explain what happens after the second reading vote in February. If we get the yes vote on the second reading vote in February, it's the legislation goes to the Health Committee. Don Davies will be shepherding it through the Health Committee, and then it comes back to the House for a third reading vote, and then on to the Senate. And all of this can happen in relatively quick order, provided that we get a positive vote on February 24th. And that is the big question, I think, of tonight, and that's why it's so important that so many people came on to this e-rally. Now, there are things that you can do, and a number of people tonight have, questioners have asked, what can we do to help out? Well, I will ask Elodie to put up our call to action. First off, in terms of what you can do, if you got the email, you got a copy of these great signs, put them in your window if you like, but also please take a selfie at the Z-Rally or shortly thereafterwards, post it on social media. You've got Peggy there in in that box there, showing her sign. On Facebook, it's Pharmacare Now. Vote yes on C-213. Twitter, the same thing. Tie in the Prime Minister and tie in Don Davies and Jenny Kwan and myself. Instagram, same thing. If you take these pictures and put them out, then my goodness, we start to get that groundswell that is certainly building up to that key vote on February 24th. Members of Parliament know, and they've been getting thousands of letters, that Canadians are watching. And our job is to make it as difficult for them as possible for them to say no. And as well, if you can, after you take the selfie at the e-rally, I'll just ask Elodie to bring up the final page. And that is the Pharmacare C-213.ca website, which will actually get a letter directly to your member of parliament. You sign on, you give your address, it will write that letter, send that letter on to your member of parliament. If you've already done this, then please ask friends, family, neighbors, people in other provinces, get them to write to their member of parliament. We're seeing some MPs getting hundreds of letters. This is extremely important. So you can add your name on the petition, write to your member of parliament through Pharmacare C-213.ca. And so these are the kinds of things you can do right after this rally tonight. We deeply appreciate all of your support. And I'm going to turn things over to Jenny Kwan for some final words.
Well, thank you so much, Peter, for your leadership on this, and to Jagmeet in leading this through. I have to say that, you know, Canadians depend on New Democrats to do and to hold the government to account. And this is a completion of the greatest Canadian voted by CBC listeners, Tommy Douglas. Let's get this done. Let's not keep on talking about universal pharmacare. Let's get this done. We all know someone who can't, you know, at one point or another in their life who couldn't afford access to prescription drugs. This cannot be the path forward. So my final words is this, to say thank you to all of you for joining us tonight. Let's keep that momentum going. I want to give a special thanks to all the healthcare workers that are out there. Linda, thank you so much to all the nurses for the work that you do each and every day, and particularly at this moment through this pandemic. The sacrifices are recognized. We feel it. We appreciate you. We love you. And thank you for your advocacy in fighting for universal pharmacare. To all of our special speakers tonight, Dr. Nima Machouf, thank you so much for your knowledge and for your advocacy and for sharing your time with us tonight. Marie Clark Walker, your leadership at the union, both on this front but on so many fronts, on issues that matter for people, for workers across the country. Thank you to Don Davies for taking the work on as our critic, relentlessly holding the government to account and driving these issues forward. Everyone, please contact your member of parliament. You can get to the website on both myself, on Peter and Dawn's website. The link for Peter Julian's website is peterjulian.ca/pharmacare. On my website, jennyquanndp.ca/213pharmacare. On Don Davies' website, dondavies.ca. Tell your MP vote yes on C-13. So our message is clear. Let's get out there and get your MP to respond, and let's get this job done. And so with that, my friends, thank you so much for taking time to join us tonight on this first ever National E-Rally for Pharmacare C-213. Let's get the job done. Vote yes, it is time.
We could do this.
And to everybody, please stay safe. And thank you so much once again.